chance to get a handout. I'm going to just leave these up here, but we'll go over some of this generally, but this just talks about if someone is interested in becoming one of the physicians or medical providers that's able to recommend medical cannabis in Utah. You can learn more about how to register to do that, following these instructions, or if you have the iPhone, you can go to the QR code to learn even more than what's on this paper here. And so I'll just leave these here. If you're interested, you can go there and learn more. If you want to do that. And then there's just these cards. If you don't want to have a large piece of paper, you can just get a card and learn that. Anyway, but my name is Rich Oborn, and I work for the Center for Medical Cannabis at the Utah Department of Health and Human Services for the state of Utah. And while we wait, I can answer any questions that people have about the basics of the program. If you have those questions, I'm happy to address those. I'll be presenting for the first hour, and then Dr. Matt McKiff. Matt, would you stand up just so everybody knows you? He's going to be presenting during the second hour, and Matt is a physician for Intermountain, based in St. George, just about to start a new clinic there, and recommends medical cannabis, not to all of his patients, just a sliver of them. And in some cases has found it very helpful for patients if they're supervised by a medical provider and get good connections with the pharmacist at the location where they buy their product. Anyway, before we begin, I thought it might be good if you have any immediate questions. If not, yeah.
I've been on medical cannabis now for about
Yo, you have no scheduled meetings, right? Okay. Okay. We should probably just start without the Zoom. Okay, cool. I'll just tell them to start. Okay. Bye.
Oh, okay.
CBD, and I wondered why the state wouldn't just have a complete CBD, which is really the medical part of it anyway.
Mm-hmm. That's a good point. So, what was your name? Ralph Frizz. Dr. Ralph Frizz was just sharing how he is a medical cannabis card holder, and as a card holder, he decided that to treat his condition, it was best to find a product that was just pure CBD. But when he went to the medical cannabis pharmacy here in Ogden, that he found out that they didn't carry something that was pure CBD, a tincture, right? And that was, or pills, right? Yeah, and that they, rather than having it, they sent you to another location where you would be able to buy that.
And you don't need a license for that.
Right, yep, because CBD is, if it's pure CBD, it can be sold by a hemp retailer that's still licensed by the state, but just not to sell medical cannabis with THC, but to sell what we call a hemp product that has pure CBD that's federally legal and that many patients find helpful if it works for them.
100% sure with the whole CBD.
Yeah, and so the concern would be, why don't some medical cannabis pharmacies sell that, right? Shouldn't the state require
I
it?
just wonder whether any others do it, or is this just an exception here in Washington?
I know that Dr. McKiff, you might be familiar with your patients and what their experiences have been finding products that have more of a pure CBD in St. George. There's one medical cannabis pharmacy in St. George And in the past, at least, there have been some challenges finding that type of a product, right?
Yes, yeah, I think they don't sell as much of it, so they rely, in St. George, a lot of my patients who just want CBD will go to
Just if you could stay here so that we
retail
could pick you up for
pharmacies,
recording.
compounding
Great.
pharmacies.
Yep, let's do it.
Down in St. George, like Stakely Pharmacy, Hurricane Family Pharmacy, these places will do CBD only, and the block pharmacy there is the cannabis pharmacy. They just kind of stick to the THC CBD mixes, and they just don't do as much pure CBD. But usually there's another option. A lot of compounding pharmacies have great stuff because they're getting into it on that level.
Right.
Well, I was wacky on 60.
And we can get into more detail on that during Dr. McKiff's presentation. And it's a great question, and certainly it's a concern we have at the Department of Health and Human Services is supply of the types of products that patients are really needing. And sometimes they don't have them in an inventory, right? And that sometimes is a concern. So we can go into more detail on that later. Great, okay.
How many dispensaries in St. George?
There's one dispensary in St. George.
And
Mhm.
compounds?
Well, and then there's hemp retailers, like a health food store where you could find hemp product, right? Like this gentleman did. Because it's federally legal, health food stores could sell the stuff that's pure CBD.
Several days ago. Oh, I'm sorry, that's for the other flip.
Oh, okay, no problem. All right, so, well, welcome. My name is Rich Oborn. I'm with the Center for Medical Cannabis at the Utah Department of Health and Human Services. And I'm going to be presenting for 1 hour on some of the basics of Utah's medical cannabis law. There have been some updates that the legislature made during the past year that I'll make sure I draw your attention to. And also, if you're new to the subject, you'll learn obviously quite a bit as we go through some of the basics. And let's go through just a little disclaimer is we're just highlighting parts of Utah's medical cannabis laws during this hour section. And I'm just going to be providing information that's current as of today, obviously. So it's not meant to be comprehensive. You or your patients can go on the state's website and learn a lot more, obviously. And what I shared today is just general information. It's not intended to be legal advice. I'm not an attorney, and I'm not a physician, but I am a public administrator that helps run the state's medical cannabis program. So here's just our mission statement. As a Center for Medical Cannabis, what we seek to do is to ensure that qualifying patients are guided by trained medical professionals to receive access to safe and effective cannabis products. And I like to focus on the term safe because unfortunately, across the United States, some of the marijuana products are not safe. And it's important that we learn why Utah's products are, according to the testing that we've done, safer than your average product that you'd find in Arizona that goes through the recreational program there, or the black market, obviously. We try to help people see the benefits of participating in a legal market opposed to the black market. And one of those benefits is that there's more safety in the products that are sold in the legal market. So anyway, that's our mission at the Center for Medical Cannabis. Cannabis legalization across the United States, it's important to have a perspective because of the way that the federal law is written right now. It's not legal in every state. States have, over time, more and more have decided to just ignore the federal law and to have their own state program. And the feds have decided to be hands-off and not to stop states from having their own recreational or medical cannabis program. So 40 states have legalized medical cannabis, and of those, there's 24 with recreational and 10 that just have not legalized. So one of our neighbors who has not legalized is Idaho, but our other neighbors I guess Idaho and Wyoming, but our other neighbors like Nevada, Arizona, Colorado, and California especially, they have very robust recreational programs in those other states that surround us. So patients will often find products that are cheaper there, but with the cheaper products comes sometimes some higher risk, and they don't come with a consultation often with a medical provider. So anyway, okay, and it's important to understand the difference between hemp products and medical cannabis products as it relates to the state law and federal law. So if a product has less than 0.3% concentration of THC, those are products that can be sold in Utah's hemp program. And there's not a limit on the number of hemp retailers in the state of Utah. There's gas stations that you might have seen, health food stores, grocery stores, doctor's offices, a lot of different sellers of this online with varying degrees of quality. And there's minimal testing that's done through the state's hemp program. It's managed by the Utah Department of Agriculture and Food. The Department of Health and Human Services does not regulate the hemp market or program at all. And it is federally legal, and so hemp, it's often processed outside of Utah to be the concentrate or into a tincture. It's manufactured outside of Utah often and then transported into Utah and then sold in Utah. But there's a lot of hemp companies that are specific to Utah that manufacture and actually cultivate here in Utah. And then it cannot exceed a THC or THC analog amount of more than 5 milligrams per serving. So it can have a trace of THC, but it can't have more than what I've described here in order for it to be in Utah's hemp program. And then products with any trace of THC analog cannot be sold to individuals under 21. Now, when a lot of people, when they buy hemp, they buy it online. And when you buy online, anybody that does that, you would want to research that retailer to make sure they're trustworthy and that there's certificates of analysis that verify that it has the ingredients that they say they have. There's some popular companies in Utah with names like Barely Legal, and literally they are barely legal. But they sell a product that has THC in it. It still meets the federal law. It's under 0.3 concentration, but it's barely legal. And it's psychoactive. The federal law has some gaps in it, and it does allow for some of the products like that. So it's a concern, and it should be a concern to patients and medical providers as they select the products they use. Yeah, there's a question.
You guys test those?
So their question is, do we do testing on hemp products that are manufactured in Utah? There is testing. It's just not as rigorous as the testing that's done on the medical grade medical cannabis. Yeah. But what we always advise people to do is to research the companies that they buy hemp product from. Either you're buying it online or from a health food store, to just research them. And those companies that are reputable, they'll be able to produce a certificate of analysis done by a company that's reputable. And there will be some type of certification that they've obtained in order to have some third party saying, hey, this company is certified by some other entity. It's really important that I would just encourage patients and providers to look for that. And pharmacies, they typically will do some of that work, but I wouldn't assume they all do that. But if I were a pharmacist working at a neighborhood drugstore, I would not want to sell anything from my location that I don't trust, right? So, but it's good to verify that the pharmacies are doing some of that verification. Yeah, there's a question.
So, no, it just, is that a national standard?
The 0.3% concentration, that is the federal law. So anything that is 0.3% concentration of THC or more is federally illegal. And some states like Utah have decided to create this little planet of state legal but federally illegal products that have THC in them at more than 0.3% concentration. Okay, so medical cannabis products, those are the 0.3% or more, and they are federally illegal. They cannot be transported across state lines. So 100% of the product that's bought in Utah's medical cannabis program from Block Pharmacy, or in Ogden, it's the Flower Shop, those are all products that were cultivated and processed, manufactured in the state of Utah because of the federal law stating that it's illegal to possess those products. Okay, and then there's obviously a much smaller number of retailers that sell medical cannabis across the state. It gives you the 15 locations there. And in Utah, there is not a limit on the amount of THC in a particular product. So there could be a very high level of THC in, for example, a wax or a resin that someone might purchase. And some people do depend on those type of products that are literally like a wax that's very high potency THC. And there are legal ways to consume that with a vaporizer, but that's just an example of one of the products that has a high amount of THC potency. Okay.
Question,
Yeah.
sorry. So when you're talking about legal and illegal federally,
Mm-hmm.
if we write a prescription to somebody to possess it legally, is that federally illegal still?
Yes. That's why a patient can't go on a plane with it. It's illegal to possess it still because it's the FAA that oversees the airlines, and I would not recommend it be transported across state lines. It's very unique because of the way things are. The federal government has decided, and there's some laws that actually, a little bit of language, I won't go into detail, but the bottom line is that they are not enforcing the law as it relates to patients that might be possessing under state law legally, but under federal law illegally. They're not putting those patients in jail, and also adults in recreational states. They're possessing federally illegal product every day, and there's consumption lounges in Nevada, and they're consuming federally illegal product, and the feds know about it, and they've chosen not to enforce the federal law. So it's weird. It's typically not like that with other laws, but with marijuana, that is the way it is. Okay. History of medical cannabis access in Utah. So our program, it all originated from Proposition 2, the state's medical cannabis law, which passed in November 2018. And then state lawmakers made some changes. And then in December 2018, that's the first time that people could legally possess medical cannabis in the state of Utah. But in December 2018, they were having to go outside of Utah, buy it, possess it in Utah, legal back then, because they weren't able to buy it from dispensaries in Utah because the dispensaries hadn't been launched yet. Okay, so it took time to get the software and the program up and running. And so the first medical cannabis pharmacy opened up in Salt Lake in March of 2020, and then after that, 14 others opened up. So the last one was in December 2022. There was one that opened up in Price. And today, in February in 2024, we reached 81,000 active medical cannabis card holders and nearly 1,000 qualified medical providers that have registered with our program since the beginning. So it's grown quite a bit. This shows that growth in a chart, and then the chart on my left, but you're right, it shows the number of new patients that have joined the program over time, what that's looked like. So although there's been a decline in brand new patients, the total number of patients has risen by about 1,000 a month. So that shows a little bit about program growth. So right now, this shows patients by county, how many patients are in each county, and also by age groups. So important to see where we're at, gives you some context for growth there. So even some of the rural counties like Paiute, Wayne, and Daggett, there are some medical cannabis card holders in those smaller counties. But we've got 33,000 of the 80 in Salt Lake County. And then we do have a population of 71 and over, about 5,000 elderly patients there, and some of them are finding some benefit as well. All right, so qualifying conditions, there's 16 total, and to have a new qualifying condition added, it requires that the legislature pass legislation. DHHS, we're not able to add any. And so here is the list of the qualifying conditions. The most common qualifying condition is this last one, persistent pain, that third bullet. Persistent pain or chronic pain lasting longer than 2 weeks that is not adequately managed by conventional medications or physical interventions. So, but second to that is PTSD. Third is cancer. But there's quite a, as you can see, I know this is kind of a small graph, but we've got about 63,000 that have the persistent pain qualification. Out of the 81,000, 63 are qualifying with persistent pain. And then that just names some of the other most common qualifying conditions. Recommending medical providers. So when we talk about medical providers that can recommend cannabis, we call them an RMP, recommending medical provider, and they fall into two types. One is a qualified medical provider, or we call that a QMP, and then there's a limited medical provider, or an LMP. And I'm going to talk about quickly some of the differences. So the qualified medical provider, these are QMPs, as we call them. They're registered with DHHS, with our office. There's almost 1,000 of them. And they can recommend to up to 1,252 patients. The reason why that's kind of a specific number is because the statute states that QMPs are limited to recommend to 1.5% of the total number of registered medical cannabis patient card holders on April 1, 2024. Each quarter we redo this. So this limit so far has increased each quarter because of the total number of medical cannabis card holders in the state increasing each quarter by about 3,000 or 4,000. So, and then to be a QMP, you have to be an MD, a DO, a PA, or an APRN, and you have to complete at least 4 hours of education during each 2-year renewal cycle. And then you have to register in what we call the electronic verification system and pay a $100 registration fee. And if a QMP receives payment from a patient's insurance plan for services, that patient doesn't count toward the QMP's 1,200 limit. And that's intended to incentivize billing insurance. What we found at the beginning of the program was that there was a lot of what some people call pot docs who were just specializing in medical cannabis recommendations. And a lot of them were doing a lot of them, but they weren't billing insurance because there was only a small number of providers at the beginning of the program willing to recommend medical cannabis. And so some of them were charging $500 for a visit and just price gouging and being kind of predatory on patients about it. But there was a market, and they took advantage of it at the beginning of the program. And so some legislation passed that said, okay, we are going to make it clear that you can bill insurance. You're just treating chronic pain, or you're treating cancer or PTSD. You're not, medical cannabis is not a diagnosis. So anyway, that is how that worked. And there's a lot of providers in our program who do bill insurance. And but there's some that still choose not to, and that's their choice. And patients still go to those clinics. Okay. And then here's where we're at as far as the types of medical providers participating in our program, whether they licensed as. So as far as PAs, there's 162, MDs 231. The biggest group is that APRN group, it's 538. And then there's a few DOs at 53. So majority are APRNs. Okay, so those are, QMPs are those who are limited to 1,200, but then if there's a provider, that's just primary care provider that's just meeting with their patients, they're able to recommend to up to 15 without registering with our office. And there's instructions about how to do that on our website. So people can, or a physician or a PA or a DO or an APRN, anyone that's licensed in the state, as long as they have a controlled substance license, they can recommend to up to 15 patients. And there's not a required continued education or registration with our office by the provider, but there is a form they fill out and submit to our office. And then our office inputs that into our software, and then they're able to have that particular patient join our program. And so this talks about the recommending medical cannabis, whether you're an LMP or a QMP, what you would have to do during those sessions when meeting with a patient. So the first initial appointment must be face-to-face. So subsequent appointments, follow-up visits could be done virtually if the provider's good with that and patient, but that first visit must be face-to-face, and then obviously it has to be done in a setting of a provider-patient relationship. This is a formal patient. And then conducting through a medical assessment, they have to review the patient's government-issued photo ID to make sure they are who they say they are. So driver's license, often a medical assistant will help with that in the intake. And then there's a requirement that they check for contraindications in the controlled substance database. There are some drugs that you just should not be taking at the same time you're taking products that have THC in them. So, and then also consider the patient's history of substance use and opiate use disorder. And then also consider the patient's history with medical cannabis or controlled substance use in the past. Those are all things that the statute talks about must be evaluated in that evaluation. Okay, and then things to document is to document something, right? And unfortunately, some of the quick visits that what we call the pot docs do, they're not documenting much, but The statute talks about documenting the assessment in the patient's record. And then optionally in the EVS, when I say EVS, that's our software. And then the advantage of documenting something in our software is that that can be viewed by the pharmacist at the medical cannabis pharmacy. And so that way information is going directly from the physician to a pharmacist, and the pharmacist can be aware of some of those items or contraindications or whatever notes you wanted to share. And then the actual recommendation is completed in the EVS or the software for that patient. And then the patient must meet with the QMP at least once a year to renew their medical cannabis card. A QMP has the option of not giving a 1-year card. If they choose to, they could choose to issue a card for 3 or 6 months instead, if they really want to make sure that a patient is not given a full year. So some providers choose to do that and do a 30 or a 6 month, not a 30, but a 3-month card instead of a 1-year card. Okay, and then just some things to keep in mind with LMPs is they have to, rather than going into the EVS when they're issuing an initial card to a patient or a renewal card, there's just the form that they have to fill out, the limited medical provider recommendation for medical cannabis form that's on our website, because that way the LMP or this provider that does not register with our program, they don't have to log in to our system. They're able to do it with the form that they can just print out. All right.
What happens if you get these forms turned in from an LMP and there's like 20 of them from one person?
So the question is, what if there's 20 forms from one medical provider that is not registered with our office? We would register the first 15, and then we would not allow the subsequent 5. If they're all coming in at once, we could only register 15 of those cards, because there's a limit of 15 for that particular medical provider. And we haven't had that problem yet. Most have registered as a QMP if they're planning on doing more than 15. Yeah. But our system is able to stop it and enforce that limit in an automated fashion. Yeah. Okay, so this is what that limited medical provider recommendation form looks like. This just gives you a flavor for what information is collected. Again, this is for those providers that don't register with our program, but who are still interested in recommending cannabis to up to 15 patients. So this form is on our website. Okay, and then in regard to dosing guidelines, a RMP, any recommending medical provider, they have the option of including in their recommendation a indication of the form that they want their patient to consume. So it could just be, I just want my patient to have a liquid suspension or a tincture. They're able to indicate that. They could also indicate that they do not want them to have a vaping device or a vaping cartridge or flower. So it's intended to work like a prescription in that way, in that the provider can place limits on what the patient purchases. It's not as specific as a prescription, but there's some parameters that the QMP legally can set on that patient if they choose to.
Question.
Yeah.
Do the pharmacies or the dispensaries understand the different conditions that these are indicated for, and then will determine what the mix is and what the amount is if you don't state?
Yes. So the question was, if a medical provider does not specify any parameters, that means that they are leaving it up to the pharmacist to determine. What often happens is that if the pharmacist will give general guidance to the patient, but most pharmacists that work at these facilities, they allow that patient to drive and try a few products if they're just beginning to see what works best for them. So in some cases, for example, what we've heard of is in some alarming cases, there's been a patient that showed up that is pregnant. And she shows up at the pharmacy wanting to purchase product. And if you don't already know, women, if they're pregnant, they should not be consuming medical cannabis with THC. And so in this particular case, the pharmacist said, hey, we know you're a medical cannabis card holder, but we're going to not be selling product to you today. And obviously pregnancy is not a terminal condition, but so that patient could come back later. And there have been, a few other isolated cases, but the pharmacists that work at the medical cannabis pharmacies are licensed by the state of Utah. They're required to be there 100% of the time. There's not a product that's sold unless there's a pharmacist physically in person present, available to consult with patients. So the hope is that that connection happens not just at the first visit, but at subsequent visits as well with the patient, and that there's some guidance obviously given by that pharmacist. Now, often the guidance given by the pharmacist is not documented. So that's a drawback. They aren't required to document, but they give their guidance, and that's how that operates in the actual setting. Yep. Okay, compassionate use board. So for those who are under the age of 21, and also for adults who don't have a qualifying condition, they are able to go to petition the compassionate use board, but only with the support of a medical provider. So they wouldn't be able to do it if they just wanted it and hadn't consulted with a medical provider. That medical provider needs to be part of the team that's petitioning. And it's actually that medical provider that petitions what we call the CUB. So, but in order to qualify for approval by the CUB to get a medical cannabis card, there must be an intractable condition. The condition must substantially impair the quality of life, and they must have tried some conventional treatment. So in these cases, and in all cases, medical cannabis should never be the first line of treatment. It should be used after conventional treatments are exhausted and they're not working. One thing that the Compassionate Use Board sees on occasion is a child with autism that's very violent, and they're needing to find something that works better than other medications. And in some cases, it's worked for some minors in helping them control their condition. When under the supervision of a medical provider and frequent visits, they're able to find something that works best in those cases.
I have a question.
Yeah.
It goes back to the thing you were just touching on with the pharmacist helping decide the formulation or the, I don't know, potency or whatever.
Right.
What is their training, the pharmacists at these dispensaries? Do they have specific training in deciding the dosing and the formulation and stuff?
That's a good question. So what training does a pharmacist that works at the dispensary have? What are they required to have? And by state law, there's a 4-hour course that we require that they go through, that our office approves. University of Utah, Intermountain, then there's 2 national companies that have online courses that we've approved. And they complete one course that's like 4 hours long, and at a minimum they must do that. Now, the expectation is that they put in their own time beyond that, just like we would expect any physician with a specific specialty, right? But the scope of practice of any physician is very large. but they're always limiting themselves to their scope of practice and knowledge, right? So same goes with the pharmacist, is that the expectation is that they go well beyond the minimum 4 hours. Some of them have gone and done graduate level study about cannabis. There's a few universities that have that option. There's a lot of research that they do about the specific formulations and products that they sell. The products are unique to Utah. These were manufactured in Utah. Now, some of them come from seeds that came from other states, the actual plants. But you can't, because you can't transport across state lines any plants over 8 inches tall. You have to get seeds from somewhere. So anyway, because of that, the pharmacists often will know a lot about the products at their location, and they do make specific recommendations about which product would work best for what condition. But what we hope is that the medical provider does their part as well and doesn't just leave it always up to the pharmacist 100%. There's this relationship that does not exist at a neighborhood pharmacy like Walgreens or Bountiful Drug, where the pharmacist really has nothing to gain from that sell, right? These are products that are all bought from giant manufacturers that, these products are processed in extreme bulk that you buy from regular pharmacies. Now, from medical cannabis pharmacies in Utah, very small number of facilities in Utah, in fact 13, process them. And often the same company that is selling it retail manufactured it and grew it, right? If it's like a flower. So it's vertically integrated. So some of the fear is that there's some gain there from the pharmacist, the same company that manufactured it and is selling it retail. So that's one of the fears that we have as a state, but it's legal, of course. Some of the same companies are also manufacturers that do retail, and we would hope that a pharmacist would always keep in mind, to not do harm to their patients, to give their patients the best chance by recommending the product that they truly know as a medical professional would give their patient the best gain.
And hopefully most would, but we know, like, in our profession as well as providers, doctors, it's the same problem. Like, if there's financial incentive, there's going to be people unintentionally or intentionally following the money, right?
Right. So yeah, that's reality. There could be, at least from the outside, there is the appearance of a conflict of interest there. But regardless, the law does allow it, and so patients are still in control of their own purchase, but product availability sometimes is not ideal. Like we heard earlier with CBD, pure CBD, sometimes you're not finding that product that is wanted at the location that's most convenient to you. Okay, so about minor cards, and we're about, I need to finish up in a few minutes, but this just talks about how those operate. There has to be a guardian that affiliates with that patient, obviously, and that purchases on their behalf. And then non-residents are able to purchase. That goes through those conditions. This is what a medical cannabis card looks like. And as far as like verifying identification at the doctor's office and at the dispensary location, there is a requirement of presenting government-issued photo ID, a driver's license, passport, state ID, in addition to the card. So it's there's not a photo on the card, but that location is able to verify with the ID that they are who they say they are. There's a question in the back.
I was just on the website too with different regulations and that on this. Why are the caregiver cannabis cards, why are they so expensive?
That's a good question. So does it cost so much more to be a caregiver opposed to just a patient? And the reason why is state law requires a criminal background check on the caregivers because they don't have the qualifying condition, but they're being allowed to go purchase. So there's the criminal background check to make sure there's certain types of criminal activity that they haven't been involved with within the past certain number of years. Yep. So it's a little bit more expensive. Yeah.
Can I ask a question on the card?
Yeah.
How come you guys don't require the doctor that authorizes its name to be on the card?
That is coming in the future. That was a suggestion we got, and that is something that we listened, and when we launch with the new software later this summer, that will be something that appears on the card. So thank you. That was a good suggestion, and it's something that others have shared as well. It will, I think, advance the patient's knowledge as a reminder of, yeah, this was my medical provider. This just was not a pot doc, but someone that was evaluating my case, and that way they're able to share that with, for example, at the pharmacy, the pharmacist is able to just see it right on the card, opposed to having to go in our system and find the name of that medical provider.
Well, I think your term pop doc is a good term because most of my patients can't tell me who the doc
Mm-hmm.
is. And because it's not on the card, I can't.
Right.
get anything.
Yeah. So, yep, that's something we're changing in the future. We're having that name appear on the card.
Will it be on Doppel?
Uh,
Because it shows that, yes, they're a holder, but it doesn't say again. Like, if someone pulls up Doppel, they'll know that I prescribed.
Oh, what you're saying controlled substance database when you say DOPL, right?
Sorry.
Yeah. So in the future, it will be, or actually right now, a medical provider can go in and they can check and search for their patient and confirm whether that patient has a card.
Yes, I can see the card, but I can't see the provider that gives them the card.
Right.
But
Yep. So that's something else we can advance as well.
Because they
Yeah.
can see if I give them
Mhm.
Tramadol, they can see, and so it'd be really nice for me to be able to see
Yep.
that doc.
And-
If you click on the little green,
Yeah.
it will show the provider. If you click on the.
I think it does, and it says the date and the
Just like sometimes you can click on legal actions and like, sometimes there's nothing there. Sometimes it is not filled out.
Oh, sometimes it's blank.
Yeah, like you may have like the little ambulance or like
Uh-huh.
the gal with the legal action. And
Yep.
sometimes it'll take you to like the next page, but there's nothing there. Like,
Okay. I'll circle back with Doppel because we are changing our software. There'll be a new software we use that'll be integrating with the controlled substance database at Doppel. And so this is a chance to ask, hey, in what cases is this blank? What percentage of cases is it showing up blank on that end, and why? Okay. Okay, yeah, so controlled substance database. Obviously, that's something that we just covered. And then there are some state legal protections for recommending medical providers. This just goes through that. And this just talks about some marketing restrictions that I think are no-brainers about limits on marketing that a QMP would do. And then here's a list of the dosage forms that are legal and some other ways they're referred to, like gelatinous cube is how it's said in the law, that third one. But then, as we all know, that's like a gummy or a chew or a gelatin cube or a lozenge, right? And then unprocessed flour, a lot of people are surprised to know that that is legally purchased in Utah. You can just get the flour. But the legal way to consume it would be with a flour vaporizer, or with just a vaporizer, and do it through inhalation rather than smoking it, which would be illegal. Yep. Okay. And then prohibited forms: brownies, cookies, chocolate. Can't mimic a candy container.
I heard that you're coming out with confectionaries.
So what's meant by that is that, that's a good point, that just passed during the legislative session. And when we say, the law says confection, but it can't be chocolate. So it's like I compare it to like a spherical or a circle form. Like that disgusting candy that you get at a wedding. That keeps your breath nice. Yeah. Yeah, the chalky stuff. But it's not chocolate. That was clear in the bill that passed, is that it can't be chocolate. So in the past, it was like just gummy. And so rather than just being gelatin or gummy, it can be like a confection form. Yep. It's like either a circle or a square, though. It can't be like a gummy bear shape.
Is there a specific reason why it can't be chocolate?
So kids won't do that.
Same thing with.
Yeah, the lawmakers felt like it was just too recreational looking, I think. Yeah, but there's some evidence that says that actually chocolate makes it more easy to consume. Sometimes for elderly people, having it in chocolate form makes it, like a gummy can be hard to chew for some people. Anyway, okay. Okay, so I'm going to end with just something that's alarming that we are concerned about at Department of Health and Human Services. If you look at that top aqua, that is, this is patient purchasing trends as of February 2024, and cartridges, vape cartridges and pens are winning by a lot, right? Second place is flower, and you look at the beginning of the program and flower was ahead, but vaping cartridges are winning by a lot, and it's a major concern. People, if you don't know already, the manufacturing process for concentrates is often something that, unfortunately, we can only test the products so much, and so it could be that there are, because a concentrate could have been heated to a certain point during that there could be compounds created that we aren't testing for yet. And that's the reality of when patients are purchasing products that are concentrates. And it's state law, it's legal, and we test them for everything that we have to do. We have to test them for, but also products that you would consume that are like a gummy or a pill. Yes, it takes longer to get in the system, but they're longer lasting, right? With a vaping cartridge, you're getting it, you're inhaling it fast, and it's getting into the system of the patient, but it's not lasting as long. So you've got some habitual use potentially developing there where they're having to take it multiple times per day. But we realize that there are immediate emergency situations where a patient may be having a seizure or something, and there's definitely a need to get it into the system fast to calm someone down. So anyway, there's a lot of reasons why we're concerned about the cartridges and pens being the highest seller, and we plan on doing some education during the next year that'll help patients and providers and the public learn more about why medicinally it's not the best option, but they still have the right to go and buy what they want. Okay. So I'm going to close. This is just a list of the locations throughout the state. There's 15, and that's who they're owned by and where they're located. And some of the requirements related to the pharmacist are listed here. This talks about the distribution system, what that looks like at a high level. There's the independent testing labs that are always a part of that process that in other states sometimes are not, but in Utah are. And there's contact information for our office.
Are your slides available?
Yes, they'll be available through the conference, and you can reach out to us later for more information. Yeah.
Has this had has this been a source of revenue for the state? Has it been like a significant driver, or has it been pretty much like, low level break even kind of?
Yeah, the question was, is this a significant source of revenue for the state of Utah? And it definitely is not. The only thing that it funds is our operation at Department of Health and Human Services, which is personnel and software mostly. And we're planning on doing public education as well in the future that the revenue will help fund. But there's $3 from every transaction that is taken. That's mostly where our revenue comes from, is that $3
Well, I'm glad your
transaction.
office is involved in helping oversee and distribute and everything.
Yeah,
It's interesting you hear that that's one of the arguments other states make for full legalization for recreational uses, like the tax and the revenue and that sort of thing. Right?
yep. Okay, one last question. Yeah,
Just a quick comment to your point about the cartridges.
yes.
I bring it up to my patients that with our poor air quality, we get enough exposure, right?
Mhm.
They should be doing edibles instead.
Yep.
And everyone really relates to that, so
Yeah.
it's helpful.
It is good, and we're hoping to just build on those messages and make that even more known. Here's some examples of the packaging that our products have, if you want to take a look at, not our products, but products of Utah, that you can take a look at that represent some of the different forms. You can also see an example of what like the tracking information would look like, and some of the percentages of CBD and THC in a particular product that is just used as an example. Just the container is available. Yeah. Okay, one more question. Yeah.
Is your drug testing recommended at all? And the other thing is that I see a lot of people have a card but still get illegal and smoke it. Is there
Right.
what is that? I mean, obviously that's.
Yeah, there's still a giant black market, and so people can get a card and assume that it protects them, but it really doesn't. If they are purchasing black market product, it doesn't protect them. Law enforcement can still take action.
And should they get drug tested like you do?
Well, in regard to drug testing of individuals that have a medical cannabis card, the law states that medical cannabis is to be approached like any other drug, where if someone is impaired while they're working or while they're driving, that they are tested, and if they become positive with marijuana or with alcohol, that can be used as evidence against them. The key is impairment, but just having a medical cannabis card is not illegal. But private employers can prohibit their employees from medical cannabis use. It's still federally illegal. So, yeah. One more, and then I promise I'm going to give Matt the rest of the time.
I read last week they're going to legalize, they're gonna let go, and so I don't know when that's gonna happen, but.
Yeah.
For 2 decades and not done anything. Federal employees do get drug tested for medical marijuana.
They do. Any employer can drug test and then terminate. Right. And the rescheduling is very complicated, and what was made public was some report that the DEA was going to draft a rule that would become effective later, but they were just in process of drafting it, that would make medical cannabis a Schedule III drug opposed to a Schedule I drug. And Schedule III, depending on how they write the rule, could have some implications that are complicated, but in essence, we expect them not to impact the state's medical cannabis program. They'll have more impact on research than our state program, because none of the drugs sold in our medical cannabis program are FDA-approved drugs. So just because it's Schedule III doesn't mean it's FDA approved. It's still got to go through FDA approval, and has to go through that channel in order to be sold legally through neighborhood pharmacies. Okay, great. Now let's move to Matt. I'm going to X out, and this gentleman will help convert us over to that. And then I'll stick around and just be patient.